Hi, everybody. I'm Alexis Webb. I'm a research program manager at Cancer Research UK over here in the UK. And so we are the second largest funder of cancer research in the world after the NCI in the US. So I'm going to start my talk on a bit of a personal note. This is a photo of my dad taken in spring of 2014, about 18 months before he received a diagnosis of stage 4 metastatic colorectal cancer. And he subsequently passed away about 2 weeks after that emergency room presentation and diagnosis. And so when I look at this photo, I think, well, did he have the tumor at the time? And what if anything, would have been different if we had detected it earlier? So we know that early cancer detection saves lives. So this is both England and US 5-year survival rate data. And if we look at the exemplar I gave of colorectal or bowel cancer, if it's caught at stage 1 or localized, you have basically a 90% chance of surviving 5 years or more. But if it's caught late at stage 4, at a metastatic stage, it's a less than 10% chance. And the same trends follow no matter what cancer type you look at. The later it's detected, the less likely you are to survive. So we know early detection is important. Why aren't we doing it more? And that's really because a lot of the challenges to the field, these are historic challenges. They've been around for a long time. And it's really only just now that we're starting to understand the biological and technological complexity, like what Daniel was talking about in his talk earlier, that underlie early stage disease. And that's really because most of the models, whether that be cell lines or mouse models that we have been based around where we see the patients, and that is often in late stage cancer. So we need to shift that mindset. We need to bring together different disciplines that have been kind of fragmented, and we need to build a stronger health economic case, which is really crucial in a nationalized health system like we have in the UK. And that's because the clear benefit for early detection from a health economic perspective hasn't really been demonstrated. And that's led to unclear regulatory and adoption pathways for novel diagnostics, and essentially poor industry engagement, which is, starting to change now with big companies like Grail. But we still need more institutions prioritizing, and obviously more scale in terms of, instead of lots of people chipping away in their own groups, bringing everyone together. So in order to do that, Cancer Research UK, starting it back in 2019, consulted with over 100 key stakeholders, mostly in the UK, but we believe that this document will have relevance for a global healthcare landscape to produce this long-term plan for what we see the future of early detection and diagnosis of cancer looking like. And it's really trying to lay out a shared vision where ED&D of all cancers is going to become a routine clinical reality. So within this roadmap, we've identified 4 strategic themes, and across those themes, we have 14 actions that all stakeholders across the pathway, everyone from basic biologists to industry stakeholders and individuals and policymakers. And we would love for you to have a look at this document. This is not just in the short term, but in the longer term as well. We've identified, as I said, the 14 different actions, and you can see those if you go and download the roadmap at this link, or get in touch with me if you'd like to know more. Thanks very much.